Hello, everyone, and welcome to RevMD Sex Bites podcast with me, your host, Dr. Deborah Durst. And I have two special guests with me in the studio today. So, Farideh, do you want to introduce yourself? And then Marissa?
Hi, guys. My name is Farideh Golombieski. I'm a nurse practitioner at RevitalyzeMD. I've been a nurse for over 10 years, and I just want to help y'all feel better and be the best version of yourself. And that's what we're all here to do and our goal.
Hi, my name is Marissa Staten. I'm the medical esthetician and laser technician at RevitalyzeMD. I've been a medical esthetician for since 2004. We won't do any adding today.
Long time.
I've been in the cosmetic industry since 1999. So
Lots of experience at the table. It's going to be fun. It's going to be a fun podcast. So we're going to talk about something near and dear to our hearts.
And will be to yours soon.
And yours soon, if not already. It is testosterone in women. And so, again, a huge gender bias when it comes to testosterone in women, and complete myth and misunderstandings and, misinformation, lots of stuff. So we hope to better clarify some of the major points so that you are looking to feel better and will consider testosterone treatment for yourselves in the future.
Absolutely. So first, I just want to say, ladies, testosterone is not just for men.
Not at all.
Not at all.
Oh, no.
Know that.
Yes.
If you're tired, your sex drive is down, your sex life is gone the complete wrong way, you're not sleeping well, everything kind of seems to be going the opposite way of what you want it to do, it might be hormones, and not just testosterone, but it is probably a hormone imbalance. We have all been there. We have all sought out our primary care providers saying, what do we do? You do not necessarily need sleep medication or depression medicine. It can just be hormones, and it can be something very simple, like a little extra testosterone. That makes you feel great.
That's right. Well, testosterone is one of the most abundant, circulating, biologically active hormones in a woman's body. So the fact that we have low T clinics around the country for men, but they don't treat women, is a problem, number one, right? So
absolutely.
That screams
There's
gender
a
bias.
clinic on every corner that men can go to and get a cream, a shot, a pellet, a pill, whatever they need to help with their hormones, their erections. But women, we just suck it all up and don't say a word.
Yeah, there's no FDA approved testosterone treatments for women. And again, why is that? And it's really because, again, if you follow the money and you want to protect the bottom line, they haven't actually formulated anything specifically for women. Not that we can't use, a testosterone injectable that's for a man, an FDA approved product, but basically, we have to do different dosing. And again, so compounded pharmacies play a huge role here.
Absolutely.
Because now they can
customize. They can customize all the different hormones that we need to manage. They can customize the testosterone dosage in the correct dosage. And they are not part of big pharma.
Yes.
So that definitely affects that bottom line on medications that are approved through the FDA for usage. So like Dr. Durst said, testosterone is not FDA approved for women. However, we've been replacing testosterone in women for many, many years. Did you hear that, ladies? Many, many years.
You will not look like a man. You will not look like a man. It is it's a female appropriate dose. And so again, hormone specialists that have been treating women are the ones that should be doing consensus statements on these treatments, because what happens is the medical community, the big organizations, big pharma, basically are doing consensus statements that everyone accepts as kind of a basis for treatment, which isn't the case if it's an expert opinion and not based on studies, and it can't be studied if it's not supported by big pharma. And if you can't patent something, you're not going to put a bunch of money into studying something that you cannot protect once it goes to market.
Which is the compounding pharmacies. Just to make that very clear, that's because we're compounding it, and it is not a large manufacturer.
Well, and the compounding pharmacies, again, are there's a role for them because now we can customize hormones and they're bioidentical. The issue is you cannot patent something that is identical. It has to be different in structure or in a formulation. So if a pharmacy, if a drug company cannot take a progesterone that's bioidentical without changing the formulation, there is FDA approved, capsules for progesterone. And again, but they have to change the formulation or they have to change the structure, which is why in the past, historically, we've had horse estrogen, horse urine estrogen and progestin.
And we've seen how that all turns out.
And we see how it turns out not well.
Not favorable.
And that, again, is an FDA-approved product way back that was found to cause problems. But again, it cannot be identical to the body. It has to be different in a formulation or in structure. And so these are bioidentical hormones that we're using, and therefore a drug company cannot patent it. They're not going to study it if they can't take it to market and protect it and make money off of it. So again, protecting the bottom line is huge, and they want patents. And so we understand all that, but it doesn't mean that we should exclude women from hormone replacement therapy and testosterone therapy because
it affects us
a company
in the
can't
same
protect
way.
It.
It affects men. It affects our energy. It affects that brain fog. It affects our sex drive, our sleep, our ability to build muscle and lose weight, and it affects all aspects of our lives, just like it does men.
And again, it's a life force for women too. So it's our confidence. Again, get that edge back, like an edge that you may not have even realized you lost. So women come for different reasons. It could be we're sitting in front of a woman that is tearful because she has no sex drive. And her relationship is falling apart because of it. And, again, there's only a couple things that are going to cause that.
Exactly. So, and a lot of times that's testosterone.
Low testosterone or medications. And so medications, antidepressants, high blood pressure medicines, or low T. So if you have low testosterone, you will not have a sex drive, and it affects relationships. And relationships fall apart for that reason. And we're talking about more testosterone right now. I mean, progesterone, of course, is your feel-good hormone and helps you sleep and stabilizes mood. And estrogen helps with symptoms too. Vaginal dryness and hot flashes. And all of them are preventative, as far as bone, brain, and heart. But we're talking about testosterone. And when we're talking about that, again, it could be a woman tearful because she has no sex drive. And remember, both men and women, like when we start in a relationship, the sex drive is there, right? And then all of a sudden,
that's it.
It's not there any longer. And so it's important to know that you can optimize your testosterone levels and get that sex drive back. And so that's just one aspect. So again, you were talking about weight
gain. So we know that, yes, other hormones do play a part in that. But if you're going to the gym, you're eating healthy, and you're just not seeing the results, you're not able to put on that muscle like you used to, and you're just continuously gaining weight or not able to lose weight, a lot of times that can be testosterone as well. We have women that come in and they're like, everything I do, it doesn't matter. I can't lose 1 pound.
Doing the same thing I always did.
Always did. And now I'm working out more.
Yes.
I'm eating even cleaner. I'm taking all these supplements. I'm doing all these things. I'm buying all these gimmicks. I'm trying all these fad diets, and I'm not losing.
Seeing the muscle tone. They're not seeing that anymore. They're seeing more loose skin or saggy skin, and they're not sure what's causing that. Testosterone will help all of those too.
Body composition changes. So even if it's not weight gain, it's the body composition changes. That subcutaneous fat, that looks more lumpy and more cellulite prone. And the anterior thighs is huge, and loose skin on the upper aspects of the knees, bra fat behind the bust
under
arms.
The arms. And Marissa sees a lot of that and does a lot of our laser treatments to help with that.
Yes.
So,
yes.
Tight
Lots
sculpting,
of them.
body effects, Forma Plus.
Yeah.
Absolutely.
Which are great, but they don't fix the bottom line,
No,
right? And that's where we go to hormone optimization.
And again, you're not going to you can spend, body contouring is very popular right now, and for a good reason, because you can reduce fat and tighten skin and contour the body and body shape. But without hormone optimization, you're not going to get sustained results. So we like to be very comprehensive in our approach. And again, we do men and women for hormone optimization. And right now we're focused on testosterone. My issue is, why not go to a clinic that does both? That is a hormone specialist in both the care of men and women. The fact that we have clinics that are just geared towards testosterone and men in replacement, and often, again, operated by businessmen and not the medical specialist, is an issue, I think. And so I would continue looking when you hit, those websites, and just make sure that you find somebody that specializes in it and can take care of men and women. And testosterone, again, some other things, brain fog.
That's huge.
Huge.
That's huge. Forgetting names, unable to pull words. So when you're talking and you're just, that stutter, you can't, that sharpness, that mental sharpness starts to fade. Testosterone, at least for me personally, brought that back. And I need to be sharp at my job. I need to be able to recall and remember.
Well, she's sharp at her job. Yeah.
It's important.
Yeah.
And it plays a huge part too, that brain fog, that mental fatigue that we feel at the end of the day. It helps with all of that. And that is a huge part of, most of the time, women are wearing many hats, right? We are working at home and at work, right? So we are moms or wives, we're in a professional role, we're homemakers, whatever it is that we're doing, we're balancing all these different jobs.
Multitasking.
Exactly. And then at the end of the day, we're worn out. And some of that is normal, but it is so often used as an excuse to just go, well, I have young children. Oh, I have a stressful job. Oh, I have all these things going on. Yes, to an extent, but were you like that 3 years ago? You still had all those same things going on, but you weren't worn out at the end of the day. And that's when you've got to have a little bit of self-reflection and take care of you, because you are supporting all those different roles in your life and in your household, and to really take charge of that. And you got to take care of you to be able to support the rest of it.
And they depend on you to take care of them. And so that's actually kind of what happened to me. That was my journey, ER, working nights and taking care of, 3 children. And again, nothing different than every other woman does. We're balancing a ton, and I just started to notice changes. And, I'm working ER. I see it in the ER. I see patients, and everything was always normal. The blood tests were always normal, and mine were too. And as I went to my first anti-aging conference, I figured out there's things you can do about this.
Normal's not necessarily normal.
Normal's not normal. And then all of a sudden you find out that there's hormones, which we don't learn in traditional medicine. And so now I'm learning pathways and hormones and,
optimal levels.
Yeah, and optimal levels and ways to support that hormone pathway. But I never even realized that you could do something about that. And again, emergency physicians are like, good at lots, we know a little bit about a lot of things, but we weren't special, we weren't experts in any one particular area. But so I would know a little bit about hormones if we were doing that in traditional medicine, and we weren't at all. So, women coming into the ER with anxiety or mood disorder or severe periods or vaginal bleeding, or again, the women with the brain fog and the energy and something's different. And that's what happened to me. So again, as I realized that there were things we can do and I started doing them and I noticed a huge difference, I realized that there's a huge gap in medicine that needed to be addressed. And so that was one of my main, ventures out into regenerative and anti-aging from ER medicine, is that you can actually make a difference in the way people feel. And medicines don't often do that, right? So we put them on high blood pressure medicine, high cholesterol. We wait until diseases happen. And so, and now you could actually do something to prevent disease and get people feeling better.
Touch on the labs coming back normal. I went to my primary care, but my labs were normal. They said my hormones were normal. What does that mean exactly for your age group? Because that means something different for, obviously, the doctor and the person asking the question.
When it's such a great question and a great point, because we have this conversation every day, that there's an average for an age, in the middle. Yes. And so there's a range, right, for the labs, whether it be progesterone, estrogen, testosterone, anything, vitamin D, anything.
Blood counts.
Yeah.
Everything has a range.
Everything has a range. So in the middle, for hormones, in the middle is an average for your age, and then 2 standard deviations above and below is still normal. Say for women it's 10 to 50 with a testosterone level, for instance. That's an arbitrary range, right? And so you could have been 50, now you're 10. You're 1/5 what you were, but you're still normal. And so you're feeling the changes. But not only that, that's an arbitrary range because those ranges aren't based. Remember, there's no FDA approved treatments for testosterone. There's no standard, consensus statements that are recommending doses or, symptom control in women. Mm-hmm. So it's not based on actual hormone specialists that are treating women patients. There has been, in 2019, they came out with a big statement, again, saying how important it was to treat women with testosterone, but that was based on hormone specialists that had many, many years of patient care with it, and it listed a lot of different things about that. But the bottom line is that accepted range is still being studied, and so you're normal in a very arbitrary, unmeaningful
scale.
Scale, and
versus the scale used for those that are specializing in hormones,
and so women that are actually feeling better with hormone replacement therapy. So
because if the lab for testosterone is 10 to 50 for a female, where were you 20 years ago? Where were you when you were 21? Where are you now? How old are you now?
Correct.
So you have to take all those into consideration.
Again, we want optimal, so we don't want to be normal. Who wants to be normal anyhow?
Right?
No,
and normal, ladies, I'm on the floor still.
I don't want to be normal. Nobody wants to be normal. We want to be optimal. And so, but optimal means something different if you actually are treating women with testosterone and are basing it on their symptom control, because levels don't correlate well with how women feel. And that it was another thing that came out of, that statement based on hormone specialists. Again, because if you look at the other statements of big organizations that kind of are against testosterone treatment in women, they are hugely supported by pharmaceutical companies. So largely funded by pharmaceutical companies. So that is a conflict of interest, number one. And again, their expert opinions not based on anything. So they're not even treating women with hormones. They're not seeing how women feel with the hormone treatment. So how could they give an expert opinion without basis on studies? So to say that, physicians that treat women with testosterone or women that feel better with testosterone also isn't based on scientific data or studies is no different than them, except the only issue is those physicians actually have an expert opinion because they're treating women with testosterone versus just a thought, of what their opinion is. So, and again, no conflict of interest because these physicians are just treating women and giving their experience with it. They're not funded by, a large pharmaceutical company. So things to know. We want to be optimal, not normal. And traditional medicine doesn't understand that concept.
No, in everything that we're doing, we talk about optimal, but the optimal is very safe. So I hear that a lot. Is this safe? We're not pushing levels that are unsafe. So when we're talking about symptom control and we're talking about levels, if you've listened to any of the other podcasts, especially when we've even talked about men, it kind of relates when we talk about total testosterone levels in men, right? So we say there's a range there too. Again, it's a very broad range, very trivial range that everybody fits in, just about, unless you're a huge outlier. So we're not looking at just that one number. We need to look at the whole picture because sometimes there are other proteins that bind. Just like with men, it does with women too. There is a free testosterone level in women, just like there is in men. We are different sexes, but we still have a lot of the same sex hormones. Mm-hmm. They're just utilized a little bit differently in the body. Mm-hmm. So we got to step back and think logically. about that. You know, we're not just looking at one number. We're looking at the comprehensive picture of all the different levels and all the levels that play a part into testosterone. So just like with men, the same pathway. We're looking at those pre-pathway. How do we support testosterone in women? How do we make women feel better, right? Because that's what it's all about with men and women. We want you to feel better in a safe way, right? So we're not pushing crazy levels. We are optimizing, and we're doing that with symptom control. There are plenty of women that don't feel well in that range that is given on a lab sheet. They just don't. They need to be a little bit higher, and they thrive on those optimal levels. They feel better mentally. They feel better physically. They are more confident. They are sleeping better. Their sex lives has improved. Their marriages have improved. Their relationship with their children have improved. Relationships with their friends and coworkers. It plays a part in all of that, because when you're not tired and dragging and you feel better, that radiates into all aspects of your life. So we're here to make women feel better, and a huge part of that is through hormones. And testosterone is, as Dr. Durst said, the most abundant bioidentical hormone free floating in our bodies. It needs to be recognized and it needs to be treated. We can't just keep ignoring hormones because maybe traditional medicine doesn't recognize it. We can't say, oh, well, we know you have it, but it's not important. No, that's BS. It's important, and we need to treat it.
We have some goal levels, and we have symptom control, which is what Farideh said. So, you know, we're looking for symptom control and some goal levels. Usually we're doing optimal. It's not the laboratory range, because there's studies to show that there's a different range, and it's still safely followed and closely followed, that get women feeling better. And so there's studies, you know, that, you know, Dr. Glasser is like probably treats more women with testosterone and pellet probably worldwide than most, and there's studies to show where that level needs to go to get women feeling better. But not only that, you know, even the study, or even those consensus statement, you know, that's based on many, many years of patient care, also has references, and about 100 references, you know, talking about levels and things with women and testosterone and how they need it and how the level doesn't correlate, but also that it's could be breast protective, which is not something you're going to hear in traditional medicine. So there's lots of myths out there. And again, as long as you're confident somebody's well trained in hormone replacement therapy, they're going for optimal levels and for symptoms to be controlled and monitoring for any side effects. Again, you can get hemoconcentration or an elevation in hemoglobin and hematocrit, you know, with testosterone in men or women. You know, that just needs to be monitored. You know, estrogen conversion is an issue for men and women, but more men, because for women,
usually we want a little bit more.
Yeah, we're either giving it or they already have it, you know, so that conversion isn't as big a deal. DHT conversion, you know, again, 10 times stronger, but so they feel better, but they might have some side effects. So just monitoring all those. But the other huge issue when you were talking about all the data points and, you know...
guys, I get all worked up because it's so frustrating for me.
Yeah, well, it is, because people don't understand it. And I think that a lot of women are scared of testosterone. They think they'll look manly. You know, their primary doctors don't think they should be on it. They don't think there's, you know, they don't think it's safe. You know, a lot of misperceptions out there, you know, that need to be clarified. But the bottom line is SHBG, for instance, is sex hormone binding globulin, and it binds testosterone so that say you have 50 in your blood, but 49 of it is bound to sex hormone binding globulin. You have one molecule that's free and active. That sex hormone binding globulin is driven up by birth control, which is why a lot of women lose their sex drive with birth control. And birth control drives, those pharmaceutical companies drive that up purposely to get acne control and indications for acne. And so if you take down your free testosterone, you're going to have less in the way of acne.
Libido.
You're going to have no libido. And so people wonder why they're on birth control and suddenly have zero libido. And it's because their SHBG will be driven up purposely on that. So it's binding everything that's in the blood, and only very little is free to actually work. And that actually is can be an irreversible elevation. So not that we can't correct it, but you have to take that total testosterone in the bloodstream a little bit higher so that the free is higher as well. So
exactly. And that's
at all
true
this,
for both men and women.
Yes. Yeah. Except the only thing is that birth control, is a huge, again, so for us not to trust some numbers and experience and, again, watching and monitoring birth control, but to just blindly trust that pharmaceutical companies and birth control are safe and aren't going to cause us any issues is definitely a perception I think we need to change in the public's mind. And so that's why we wanted to do this podcast, to talk about testosterone a little bit, just so people understand that we're really trying to help with things that you might already be on, causing an issue, or if not, that you're experiencing, and we can make a difference in. Huge quality of life changer.
We definitely can replace testosterone in multiple ways, right? So there's not one way to replace testosterone in women. So there are different modalities. There are creams, there are injectables, and there are pellets. So there are options out there as well. As Dr. Durst said, there is this huge misconception surrounding testosterone in women, but it is safe and it is a life force, and it does make a huge difference in day-to-day interactions and in your life. Dr. Durst talked a little bit about her experience. For me, I went from working 12-hour shifts with a family and a good relationship and with my husband, and everything was great. And, things started to slowly change. And you're like, but I'm not that much older. What's happened? Where did that energy go? Why can't I keep up anymore? Why am I tired at the end of the day? And, the quick answer is, oh, well, you're not sleeping good. Take some sleeping medication. Well, sleeping medication isn't the answer. That's just going to make me more groggy in the morning. And then you start taking that, and that drives your libido even lower. I said, well, I'm going to just do hormones. I'm going to do a hormone panel. Getting a hormone panel was like pulling teeth to the point I just had to draw my own hormones. Nobody wanted to draw them because I'm young, is what they said. You're not menopausal. You don't need your hormones checked. Well, something's not right, and all my other blood work looks good. So I drew hormone panels and found out, my testosterone is extremely low. Replaced it, and all those things that started to slowly slip away, that energy, that brain fog, that libido, all started to slowly come back. And no sleeping medicine, and I'm sleeping great. None of these other things, no other medications. And it has made a huge difference in my life and has really driven me to start looking at hormones for women, especially testosterone, because of that, because so many women come in and say the same thing to me that I experienced. I went to my primary care. They didn't want to draw levels.
They said you were normal.
Or they did draw. And then I'm normal, but I don't feel normal.
And even some will say it's abnormal, but they don't do anything about it. So
go see a specialist. My doctor said my hormones are off and I needed to see somebody about my hormones, so I'm here.
Yes.
Or my doctor said they're off, but, we don't need to worry about it until I'm menopausal. And that's why I'm here, because they're not doing anything about it. So there are definitely clinics out there for all those women that are listening that feel like something's off, but their blood work is normal.
It's such a crucial point that you understand that the traditional doctors they're not intentionally trying to keep you from anything or testing anything. It's just not taught to us, and I'm traditionally trained. It's just not taught to us in traditional medicine. And so if we don't know about it, just like I didn't know about it when I went to my first anti-aging, and it was like an eye-opening experience because now all of a sudden I'm learning about it and I didn't know it existed. So if you don't know about it and you don't venture off to learn about it or remain open-minded to the fact that half of what we learn in a medical education is going to be wrong by the time we're out and practicing, then you're going to miss that opportunity to help your patients. So they're not doing it intentionally. They just don't know. And so,
No, and I love my primary care doctor.
Yeah. Well, and I prefer them just to say, go,
Exactly.
go to
Exactly.
hormone
So I am
specialist.
not by any means,
Yeah.
it's just the difference between a specialty, right? You go to an endocrinologist, they're going to look more into hormones. That is what they specialize in versus primary care.
I don't know about that.
Well, but more so than a primary care.
Yes, true. But I'm still shocked at how many endocrinologists don't look at hormones. Yes, I mean, I get
agree.
your point though.
But
we'll go to the surgeon. Like if you need cut on and you need a surgery, something acute, you're going to the surgeon. You're not going to your primary care.
There you go.
And so you want to go to a hormone specialist if you need hormones, because the endocrinologist, because again, that's what we learned. Traditional stuff was endocrinology, but it's like at a level that is way lower than what we're doing from a hormone evaluation now,
Very true.
comprehensively looking at it for both men and women. And so, and I still find it shocking sometimes that some of the things that they'll do, and I don't understand why that hasn't changed over, the course of a decade that we are. But I think I do understand. And that's why we're having this podcast, is because again, big pharma, really drives changes in medicine and prescribing and public education. We're seeing a lot of that now. And if big pharma can't patent it and do studies to protect it once it's taken to market, then you will not see the education publicly on it, which is why we want to get the word out there that there are safe options, like Farideh said. There's creams you can use, there's pellets, there's injectables, they're safe. We monitor levels, we monitor side effects, and we are going to gear it toward your symptoms and your improvement, and it's individualized. And
completely.
Safe. And safe. Completely individualized, because everyone is so different and there's so many different starting points, and you may be perimenopausal, you might be menopausal, your SHBG might be way up. And so again, if you've been on birth control for years, but getting all that data and then getting you on the right treatment for you based on your symptoms is so important. And so you're not going to look like a man. No. And, we optimize everyone in our office that has symptoms, and, non-optimal levels has been optimized. And I don't think any of us look like men, right? But we can sit women. What we love about what we do is we do love caring for both men and women. And when we sit women around a room, they're all going to say the same thing, and they're all going through it together. And so you're not alone by any means.
Not at all.
No. And so just having those conversations, but realizing it is different than traditional medicine. It's not a one and done. You're not going to sit in, get some blood work. We're going to quickly go over it, place you on a prescription, and see you in 6 or 12 months.
Oh, no. It's very interactive. It's very multiple touch points. We see you guys a lot in the beginning because we are managing multiple hormones, testosterone being one of them. Mm-hmm. But we will see you often and make sure that your treatment plan is changing as we go to meet your needs.
And I think that is one of the main reasons why we're gearing this towards testosterone, because even progesterone and estrogen have become a little more accepted. Mm-hmm. And even the medical, they don't always do it right, because again, there's ways that we do it that we would not do it in, pill forms of estrogen and, but at least there's some FDA approved, products for progesterone and estrogen. Testosterone still is highly unrecognized as a need for women. And so that's why we wanted to do this, to let you know that it is so important that if you're having any of these symptoms, don't want to have sex, no arousal, poor orgasmic strength. We really haven't hit
we
that.
haven't even talked about that.
Yeah, that alone is going to change with hormones, and then it's going to change with childbirth, and then it's going to change with, perimenopause, menopause, and of course, surgeries, vaginal deliveries, all that. So, orgasmic strength is huge, and that's another important one that you can get back. So, anything else you guys think we need to?
There's lots of anti-aging benefits, so yeah.
Oh, huge anti-aging, preventative, I know.
Yeah.
What Marissa touched on it, skin, hair, and nails. Skin is huge for estrogen and testosterone and effects on it.
Yeah.
Bone.
Yeah. Structure.
Structure. Just think about, your bone needs to be strong. All diseases start as we start to age and our hormones decline. Brain health, cardiovascular health, lipid panels. There you have improved lipid panels with hormone optimization. You have
improved blood sugars.
Yes, improved insulin sensitivity with hormone optimization. A ton of health benefits. So glad you brought that up.
I see a lot of difference in women's cheeks. Like they have more muscle tone in their cheeks on testosterone, as well as their legs and their arms, which they're always concerned about getting flabby.
Oh yeah,
I think I kind of said that earlier, but
well, that's because
that's just one of the good things.
We're still thinking about it.
Yeah,
nobody wants to be flabby. We're always thinking about flab, right?
Or thinking about not having.
And when we're coming to see you, we want it all gone.
We want it gone for sure. If you have any other questions, please share on the comments, subscribe, share with friends. Let your buddies, your BFFs know that there are options out there. And women are more likely to talk to other women about it. Yes. The only issue is sometimes we don't talk necessarily as much, definitely more than men, I think, about orgasmic strength and, drive. We're a little more open than men with bonding over that, but which is good. But share experiences that you've had with, any kind of hormone replacement or pellets. And again, let us know things you might want to hear about in the future. And thank you, Farideh and Marissa, for being with us today. And again, let us know what your thoughts are, because we're here to revitalize your look, your health, and your sex life. Thank you.